Good morning. Well, this is Dr. Martha Lee. I'm very pleased for her to join us today. And I think what we're going to do is talk a little bit about body image and deformity, if that's okay with you. Now, in my practice as a physio, I spend a lot of time dealing with patients post-operatively who have scars in various different places of their body. Obviously, with spinal surgery, it's either sort of anteriorly around abdomen, sides, or on the back, on their spine. And I know it's a great debate about where the scar should be, because after surgery, lots of patients do have some negative thoughts about scarring. And in this context, that can impact upon their intimate relationships. So I'm fascinated to know, from your perspective, what hints, tips, advice would you give to somebody who perhaps had some negative views about their body, their image, their scarring, and how they could maybe overcome that? Big question.
Yeah, I think we should have the permission to grieve about what we've lost, but also what we've gained. So I know of people who really love their scars because it shows that they've lived life and they are champions and warriors. There are people who do a tattoo around their scar so that it's not so obvious, and it's also something that turns out into a piece of art on their body. So they could do different kinds of things, like wear different lingerie, bra if it's a breast surgery, or corset. End of the day, I think a lot of it is just about having self-compassion and knowing that nothing in life is perfect.
Yeah. So that's a really good idea. Is one technique is to obviously disguise the scar in various different ways. But another way perhaps would be to teach somebody how to accept. I mean, I've got scars and I'm very much an advocate of it's a story of my life and I'm quite proud of them. But I'm very aware that a lot of people feel very ashamed. So how do you switch somebody's mindset from being ashamed to almost empowered by what that scar means?
Perhaps with a therapist, like working through the scar story, what it means for them, and having that ability to talk about the way they feel and what they feel they need from this experience can support them to start to shift towards acceptance. So you may remember that I have this exercise, which is the mirror exercise. I'm going to share it again later. I get them to look at themselves in front of a mirror and then go through every single part of their body. It can be clothed, unclothed, and just talk about how they feel about each part. And the way we feel about our body and different parts of our body will change over time. So then from there, doing a reflection. Do you have more parts you like or more parts you don't like, and why is that? Of the things that which one do you tend to focus on, the parts you like or the parts you don't like? And what do you think people think about it? And through that, they start to have a different lens of looking at not just one thing all the time that people are not even looking at, but the whole body, because that's what people do. They take in the whole body. And so when they can have a wider perspective, they start to realize that, yeah, it's really the little things that we are obsessed about. And it's not serving them in any way in being happier. And it does make a difference whether it's visible or invisible. And if they are invisible, it genuinely doesn't bother some people. Like stretch marks, scars, And that particular mirror technique works really well for those people who have actual deformity, whether that be a scoliosis or a kyphosis. Even after surgery, they may still have a deformity present. So I suppose the mirror technique works really nicely for those, doesn't it? And maybe like getting them to repeat certain affirmations or mantras in their head. So one of my favorite is, I do what I can, let go of the rest. So it's really accepting that, there's only so much and life is not perfect. And we can try and we can beat ourselves up. But end of the day, what's the point?
Yeah.
We're just wasting time. I call them like putting poison into our bodies, because over time they do build up like toxins, they do build up, and it really starts to affect you so much. It's not worth it.
Yeah. So it's really trying to change your mindset, mind frame, from the negative to the positive, isn't it?
So there's the CBT, cognitive behavioral therapy, which works very well to make it more structured. Yeah. So it's getting people to maybe write down their thoughts around it, why they think the way they think, and then how the thoughts that they have makes them feel. Feel ugly, feel disempowered, feel depressed. And then from there, let them also see for themselves, because of the way they feel, what do they do then? Maybe they don't go out, they stay at home all the time, they don't have friends. So then letting them see it for themselves on a piece of paper or board, and then asking them like, okay, so if you want to change the outcome, what do you think you need to change in terms of the way you think? So letting them come up with the statements for themselves is very powerful, rather than I come up with them for them.
So and that's a really good thing that people that are listening to this could do at home, is actually to get a piece of paper and write down their thoughts, their feelings, their beliefs about their body, their scar, and then from there use it as a really easy exercise to work forward, possibly with the mirror technique as well.
And they could write a story around the sky as well. So they can choose to publish it and use it for greater good. So that's what a lot of people that I know, they write birth stories, you know. That's also their way of documenting it, remembering it, reconciling it within them.
Yes, that's a really good way, isn't it? Just to write down and express, you said, your journey, whatever that may be and whatever body part that may affect. But that again is part of that acceptance, isn't it? Which is, I think, it's a fabulous idea. Actually, that's brilliant.
So there are people who feel that I can't write, then they can record instead and get it transcribed, or do it with a friend. But I think it's very important. I think even though we are all different and yet similar, I think the more voices we put out there, the more we normalize that not everybody think and feel the same way, and it's important to honor everybody's story.
Brilliant, thank you. Final thoughts?